Hello, knowledge lovers. Today we will embark on a journey of discovery and education on a topic of extreme health importance: signs of stomach worms. This video is an essential guide to understanding the symptoms that may indicate a worm infestation, a health problem that affects millions of people around the world. Therefore, before we continue, we would like to invite you to subscribe to our channel and activate the notification bell. Why? Because being informed about these signs can be the difference between detecting a health problem at an early stage and avoiding serious complications. Therefore, follow every detail of this video, as it can provide valuable knowledge for you, your loved ones, and your health. After all, education is the best tool for prevention and care for our health. Join us on this educational journey and pay attention to the warning signs that could make all the difference in your quality of life. 1. Persistent abdominal pain. Persistent abdominal pain, the first sign of possible stomach worm infestation, is often caused by irritation from parasites in the lining of the gastrointestinal tract. This pain can vary in intensity and location, but is typically described as a constant dull sensation in the abdominal region. Worm infection can lead to inflammation, ulcers, and other damage to the lining of the digestive tract, resulting in persistent abdominal discomfort. Although the pain may be mild initially, it is important not to ignore it as it may worsen over time, along with other symptoms associated with worms, highlighting the importance of seeking medical evaluation for proper diagnosis and treatment. 2. Changes in appetite. Changes in appetite, the second sign of a possible stomach worm infestation, can vary, leading to a decrease or increase in appetite, depending on the type of worm and the stage of the infestation. Some parasites can interfere with nutrient absorption, leaving a person feeling prematurely full and losing appetite, while others can stimulate the appetite, resulting in an unexplained increase in food intake. These changes in eating behavior are often accompanied by symptoms such as abdominal cramps, flatulence, and even vomiting, making it important to monitor any significant variation in eating habits. Early diagnosis and treatment are crucial to eliminating worms and restoring digestive health. 3. Unintentional weight loss. Unintentional weight loss, the third sign of possible stomach worm infestation, is often a direct result of the parasite's impact on the digestive system. The worms consume part of the nutrients ingested, competing with the host for food resources, which leads to a gradual and inexplicable loss of weight. This symptom can be especially concerning when it occurs along with other signs of heartworm disease, such as abdominal pain, nausea, and changes in appetite. Weight loss should not be overlooked as it may indicate an underlying parasitic infestation, requiring medical evaluation for proper diagnosis and treatment in order to eliminate the worms and avoid more serious complications. 4. Nausea and vomiting. Nausea and vomiting, the fourth sign of possible stomach worm infestation, are often uncomfortable gastrointestinal symptoms associated with the presence of parasites in the digestive tract. Worms can cause irritation, inflammation, and partial obstruction of the digestive system, leading to persistent feelings of nausea and, in some cases, triggering episodes of vomiting. These symptoms may be intermittent, but if they occur regularly, along with other signs such as abdominal pain, changes in appetite, and weight loss, it is important to seek medical advice. Proper diagnosis is crucial to determine the type of worm involved and prescribe appropriate treatment, which may involve antiparasitic medications, helping to eliminate the parasites and alleviate associated symptoms. 5. Abdominal bloating. Abdominal bloating, the fifth sign of possible stomach worm infestation, occurs due to the impact these parasites have on the gastrointestinal tract. Worms can cause irritation and inflammation in the lining of the intestine, leading to an abnormal accumulation of gas and fluid in the abdomen. This buildup results in an uncomfortable and visible feeling of bloating, often accompanied by a feeling of fullness. Bloating can be intermittent, varying in severity, but when it persists and is associated with other symptoms such as abdominal pain, nausea, and changes in bowel habits, it is essential to seek medical advice. An accurate diagnosis is crucial to determine the type of worm involved and initiate appropriate treatment aimed at eliminating the parasites and relieving abdominal discomfort. 6. Intestinal problems. Intestinal problems, the sixth sign of possible stomach worm infestation, can manifest in several ways, including diarrhea, intermittent constipation, and the presence of blood or mucus in the stool. Worm infestation can disrupt the normal functioning of the gastrointestinal tract, leading to imbalances in nutrient absorption and movement of food through the digestive system. This can result in frequent episodes of diarrhea, characterized by watery stools, or constipation, in which stools become hard and difficult to pass. In more serious cases, the presence of worms can cause irritation to the intestinal lining, resulting in bleeding or mucus in the stool. These intestinal problems should be promptly evaluated by a healthcare professional, as they may be indicative of an underlying parasitic infestation that requires proper diagnosis and treatment to eliminate the worms and restore digestive health. 7. Fatigue and weakness. Fatigue and weakness, the seventh sign of possible stomach worm infestation, are often associated with the interference of these parasites with the absorption of nutrients in the gastrointestinal tract. Worms compete with the host for essential nutrients, leading to a decrease in the availability of these vital components to the organism. This can result in persistent fatigue, muscle weakness, dizziness, and a general feeling of being unwell. Lack of essential nutrients, such as vitamins and minerals, due to parasitic infestation can compromise the body's energy and the proper functioning of various systems. Therefore, fatigue and weakness that cannot be explained by other reasons must be investigated, and seeking medical assistance is essential for diagnosing, treating, and eliminating worms, in addition to restoring the patient's vitality and well-being. In summary, recognizing the signs of stomach worm infestation is crucial for early detection and effective treatment. Symptoms, which range from persistent abdominal pain, changes in appetite, unintentional weight loss, nausea, abdominal bloating, bowel problems, and fatigue, may be indicative of an underlying condition that requires immediate medical attention. While the information presented here may be informative, the importance of consulting a healthcare professional cannot be underestimated. Each person is unique, and symptoms may vary depending on the type of worm and other individual factors. Medical evaluation is essential for an accurate diagnosis and personalized treatment, aimed at eliminating parasites and restoring digestive health. Therefore, if you suspect a worm infestation based on the symptoms discussed, it is essential to seek medical advice to ensure the best therapeutic approach and your long-term well-being. Thank you for taking the time to watch this video. Sharing this knowledge is essential, as it can help raise awareness of the importance of recognizing the signs of stomach worms and seeking medical care when necessary. Share this video so that your friends and family can also be aware and take preventive measures. And be sure to check out the next video on our screen, as it will cover equally valuable information for your health and well-being. See you soon!